Hello, welcome to the webinar. My name is Joshua Music, and I will be your host for today. It looks like we have a few more people that are logging in right now, so I'm going to give it just a minute, and then we will get started. We're excited to share this webinar with you, so see you in just a moment. Welcome to the webinar. We're so glad you joined us today. Folks, today we are going to show you the easy 4-step formula you can follow to understand Medicare completely and find the very best coverage at the very best price without doing hours of research, dealing with pushy insurance agents, sorting through mountains of junk mail, and in the end being forced to just guess and hope you don't make a mistake. Because the reality is, Medicare is very confusing. There are so many options available to you that it's easy to get buried in all the complexity and confusion and end up frustrated. That's fine. Okay. Well, today I have a very special speaker who is going to cut through all that confusion and show you exactly how to get the best Medicare coverage available at the lowest price with absolutely no hassle or headache. But before I introduce him, I want to share with you 2 goals that we have for you today. The first goal is to save you time and money. The second goal is to keep you from making a mistake. You see, every day people do make mistakes. And folks, as you know, there are no do-overs in retirement. You get one shot at it. Getting great health coverage can be a huge blessing to your retirement. Just the same, getting poor health coverage could be your biggest curse. Here's the truth. Almost 100% of Medicare mistakes happen because someone tried to figure it out all on their own. So today, our goal is to keep you from making that mistake. Now, if you stay until the end, I'm going to send you a couple things. First, I'm going to send you all my slides and a recorded version of this webinar. We are recording it, so don't feel like you have to write down every single word. Okay, I need you to really pay attention and just don't get caught up writing stuff down. I will send everything to you. Secondly, I'm going to send you a guide that I wrote called The Ultimate Guide to Spending 15 Minutes Per Year to ensure you have the perfect drug plan. This is going to be a resource you're going to look back on and reference for years to come. Now, there's 2 Medicare paths available to you. Let me show you the first one. This is what I call the normal Medicare path. Here's what happens. Most people research Medicare, okay, whether that's online or by reading stuff. They end up getting confused and frustrated because there's so many options and so many rules. So they end up just enrolling in coverage, but they don't really understand it or they don't know that it's the best. But they run out of time, so they buy a plan. Well, maybe months later, maybe years later, they find out they made a mistake and they really didn't buy what they thought they were buying. And so the path continues. They start over. They research Medicare. They get confused and frustrated. They enroll in another plan and then find out later they made a mistake. I don't believe that you should have to do that. There's a better Medicare path, one that we're going to talk about today and one that I think you should be able to follow. Here's how it goes. First, enroll in a Medicare What You Must Know educational program. Now, there's all kinds of these out there, but what you're watching today qualifies as that. You need to learn from somebody who knows what they're talking about, an expert, and that's what you're going to learn from today. Secondly, you need to consult one-on-one a Medicare expert about your specific situation. You need to talk to someone who's been there and done that, someone who's helped hundreds or maybe thousands of people walk through Medicare. They're out there and you need to find somebody that can help you. Thirdly, once you've done this, you're able to enroll in coverage with confidence, and then when you go to use your plan, you're going to love it. Okay? This is the path that I think everybody should follow. Let me introduce you to our speaker today. His name is Marvin Music. He actually happens to be my father. Let me tell you a little bit about him. He has presented this webinar hundreds of times to thousands of baby boomers. He's done hundreds of live local workshops across the country. He's recorded this show for some PBS TV audiences. He's personally sat across the table, sat across the conference room from thousands of people and walked through their specific situation and helped them get great coverage. He invented something that we call the Medicare Grid, which is how we are able to get Medicare on one page and make it clear and succinct for you. He studied Medicare for, I think, around 14,000 hours. We were talking about this before the show. And guys, I don't think there's anyone here listening to this, me included, that has studied Medicare for that long. But he has, and so he knows literally almost all of it. He is the creator of the 4-step Medicare process that we are going to be teaching you today. That being said, let me introduce you to him. His name is Marvin. Welcome to the show.
Thank you, Josh. It is great to be with you and those joining in on today's webinar. Medicare is certainly a program that is confusing, it's intimidating, and at times, truly, it's just overwhelmingly complex. And unfortunately, when Medicare recipients make mistakes, those mistakes can be quite costly. That's why through the years, we've worked hard to figure out the very best way to help individuals and to help couples make the right Medicare decision for their specific situation. Now, we've done a lot of things right, but in our beginning days, it was very challenging, and honestly, we did a lot of things wrong as well. It took us a lot of time to figure out this massive government program with all of its deadlines and penalties and all the red tape. We had to learn how and when to dot all the I's and cross all the T's. And that's why I can really relate to people who are turning 65 and beyond and are thrust into the Medicare world. They are usually given very little direction, and yet they're forced to make a decision that could affect them for the rest of their lives. So let's jump right in and let's take a closer look at the critical details involved in the Medicare decision. After thousands of hours of study, we've learned that there are 3 main components involved in everyone's Medicare decision. Number 1, you will get your Medicare card using one of 2 enrollment periods. Both are simple to use. Secondly, you are only given 2 options for coverage. Number 1, original Medicare, including a supplemental plan, or number 2, a Medicare replacement plan. And last but not least, you will purchase your plans from one of 2 types of insurance agents. There is no way around this. Most people find that using the second type of agent is usually in their best interest. Now, Josh, sad to say, another discovery we've made through the years is that most people are forced to do Medicare the hard way. But fortunately, for those of you joining in on today's webinar, you don't have to be like most people. We're going to show you today how to avoid the hard way and do Medicare the easy, efficient, and enjoyable way. Let me explain what I mean by the hard way. Well, the hard way is talking to friends and others, what you're going to find is that the more you talk to other people, neighbors and family, the more confused that you're going to be. The hard way also is searching online, going through all the junk mail that you're receiving, going onto Medicare.gov. You see, folks, you got to realize that most of the articles that you're going to read online or receive in the mail have to legally cover every little situation that's available. And really, it's impossible then through all that to get clear and concise direction. Also, there's 2 million insurance agents who want to sell you something. Now, 95% of those agents care about only one thing, and that is selling you a plan and making a commission. That's how they get paid. They usually don't care about educating you. They're done and on to the next person. Their goal is to enroll you in a plan as quickly as they possibly can and then get on to the next person.
Yeah, Dad, I think the question that we're really asking folks is, hey, do you want the easy way that you can confidently choose the very best Medicare coverage? And if you say yes to that question, then you need to really pay attention to this. Because since 2009, I've watched as my dad and the experts on his team have walked thousands of people through this easy 4-step formula, and they end up with coverage that they love. In fact, I don't know that I've ever seen it not work. Real quick, before we get started, my attorneys tell me that I have to say this. I'll let you read this entirety whenever I send it to you, but let me just read the first paragraph. The information contained in this presentation is general in nature and does not take into account your personal situation. You should consider whether the information is appropriate to your needs and where appropriate, seek professional advice from an advisor. Okay, so I got to get that out of the way, but let's go ahead and jump right in. Here's what the 4-step formula is. You might grab a pen and jot this down. Step number 1, you all out there need to determine your correct enrollment period. Okay, you need to determine when you're going to enroll. Step 2, decide between original Medicare or a Medicare replacement. That's your choice. Step 3, compare drug plans using a simple process because there's probably 25 drug plans available to you. So you got to know how to compare those. And then step 4, choose someone to process all the enrollment paperwork.
Okay, Josh, so step number 1, it says determine the correct enrollment period. And the question is, why is this so important? Well, first of all, to avoid Medicare penalties. Folks, almost every part of Medicare has a potential penalty if the enrollment is not done the right way and at the right time. Secondly, this is important so that coverage will start at the perfect time. You see, you don't want delays or overlaps or gaps in your insurance coverage, and none of these will occur if you will follow our system. You need to determine the correct enrollment period for your specific situation. You see, there are actually 3 types of people that are watching this webinar today, and all of you will fall into one of these 3 categories, and you will need to make your decision accordingly. So first of all, there are those of you that are turning 65 soon, and you will be retiring soon. The second group of people are those that are already 65 or above, and you're planning to continue working. And the third group of people are those that have worked past 65 and now you're making a decision that it is time to retire. So let's look at each of these scenarios. So scenario number 1 are those turning 65 very soon and you are already retired or you know that you will be retiring in the next few months. So the question is, when should you enroll into Medicare? Well, if this is your situation, first of all, you're given what is called the initial enrollment period. The acronym is IEP. And this is used when you need to start your Medicare benefits at 65. This initial enrollment period lasts for only 7 months. So you have 7 months to sign up. That period of 7 months begins 3 months before your 65th birth month, the month you turn 65, and then 3 months after that. And we highly suggest that you enroll in advance, which means the 3 months before you turn 65, so that your coverage will begin the very first day of that month in which you turn 65. Now, this next slide is going to show you an example of someone's initial enrollment period. Again, it lasts only 7 months, and this person is someone who's turning 65 in July. And again, this is someone who needs to start Medicare in July because they have no other insurance coverage available to them. So they're going on Medicare. And so this initial enrollment period began 3 months before. That would be April, May, and June. And if you will enroll during those first 3 months, your Medicare coverage begins July the 1st. But if you delay for whatever reason or you procrastinate the enrollment, what will happen is this. If you are turning 65 in July and enroll in July, your coverage on Medicare won't start until August. If you wait until August, Medicare will not start your coverage until October. And if you wait until October, they won't start you until January the following year. So you can see what's happening. If we wait until the birth month or thereafter, then your coverage for Medicare is going to be delayed. And so that's why we encourage you, if you need to start Medicare at 65, do it the 3 months before. Now the next question is, how do you enroll into Medicare? First of all, if you're receiving a Social Security check, your card will show up in the mail automatically. Nothing you had to do, about 100 days before the month that you turn 65. That's the way the system is designed to work. Medicare knows that you're receiving retirement benefits, and they're assuming that you do not have a group plan available to you. So they mail the card to you. Now, there are times when you're receiving Social Security and the Medicare card doesn't show up. Well, problem is it could have gone to the wrong address if they don't have your up-to-date address. Could be that you could have accidentally thrown away that card. Many people do this because they get so much junk mail and they throw that Medicare card away. And so if you've done that or you cannot find the card, just simply call the national toll-free line here listed at 800-772-1213 and Medicare will send you a card within about 2 or 3 weeks. So that's for those of you that are receiving Social Security, your card should automatically arrive. Now, for those of you not receiving Social Security, what you're going to need to do is you're going to need to self-enroll. So that's those of you who have decided that you're not going to take Social Security yet, for whatever reason you're waiting, but you do want to start Medicare at 65. There are 3 ways to do this. The first one and the easiest one is to enroll online. Here's the website here, socialsecurity.gov/Medicare only. It will take you less than 10 minutes to do your enrollment in this method. If you're uncomfortable with that, you can always call the toll-free line. You'll probably have to wait an hour before you get someone, but they will certainly help you do it. Or most times you can stop by a local Social Security office. Sometimes you'll need an appointment. Other times they'll see you on the same day. But these 3 methods will get you enrolled into Medicare if you're not already receiving Social Security. And after you've done the enrollment, your card will arrive in the mail about 4 weeks after that enrollment period. Now, that's scenario number 1. Now, let's look at scenario number 2. This is for those of you that are still working. In other words, your 65th birthday is approaching, and you know that it's not yet time to retire, so you're going to plan to continue to work for some years. And so what do you need to do? Well, you may not need to do anything at all at this time, which means if you're happy with the employer plan, you like the cost of that plan, the coverage of that plan, you really don't have to do anything at this time. Now, Medicare encourages you to enroll into Part A. We want you to be aware of that. And the reason they do is because it's free. But we also want to remind you that you do not have to take Part A if you have a group employer plan available to you. In fact, if you do not take Part A or Part B or Part D because you have a group employer plan available, you will not be penalized if you decide to delay enrolling and pick up Medicare at a later date. The key is you must have insurance in place at your employer that is considered credible coverage. And if you have that in place because you're still working, again, you don't have to do anything at this particular point in time. Now, we want to remind you that if you're still going to work and you decide to go ahead and take Part A because it's free, that if you do that, you can no longer contribute to a health savings account. Some of you are going to have a high deductible insurance plan with your employer, and with that is usually attached a health savings account. And so if you are on a high deductible plan with a health savings account and you take Part A, just remember you can no longer legally contribute to that health savings account. You can keep the money, it's all yours, just no new contributions. Now, for those of you that are receiving Social Security, the Medicare card, A and B, is going to show up in the mail automatically. And if you're happy with the employer coverage that's available to you, what you can do is you can actually delay taking your Part B benefits. If you're taking Social Security, you will have to stay on Part A, but you don't have to keep Part B. And so when the card shows up and you do have a group plan available, as long as it's based upon active employment, you can send the card back in. And what you'll need to do is, as the slide shows here, you need to mark off here that I do not want medical insurance. That means you're not going to take Part B yet because of the group plan that is available. You sign the card, you send it back in, and Medicare will amend your benefits. They will send you a new card that'll say hospitalization only, Part A, and then you can pick up B whenever you lose that group employer provided plan. And so it is fine to delay that. Now that's scenario number 2. Now scenario number 3. This is for those of you that are over 65. You may be 67 or 69 or 75. And you have decided it is now time to retire and you're going to lose the group plan. So the question is, when should you enroll into Medicare? Well, you're going to come into Medicare when you lose that group plan, and you're going to come in using what is called a special enrollment period. So this special enrollment period is for those who didn't enroll at 65. Why? They didn't need to, because they or their spouse were already covered by that employer-provided plan. And now you're going to retire, and so that plan is going to be going away. It will be eliminated. And so how do you use this special enrollment period? Well, first off, you can sign up and you can start your Medicare coverage anytime that you are still working. Now, folks, it is not uncommon today for people, when they have their employer group plan open enrollment period sometime throughout the year, that the employer plan will give you their offering. They may give you 2 or 3 different options. And what we're finding more frequently now is that people are going to continue to work past 65, but they're looking at the employer option, and sometimes the premiums are much higher and the coverage is not as good as their Medicare option. And so it could be that if that's your situation, that you may even want to use Medicare while you're still working. Medicare may be a better option, may be a better price and better coverage. And so while you're still working, you can use a special enrollment period. You can say no to the employer plan, and then you can start your Medicare benefits and just continue to work. And I can assure you, your employer will shed no tears if you decide to go on Medicare. They'll be happy for someone else to be able to take care of your insurance. And so if that is your situation, what we always suggest is look at all the employer options and compare that to what Medicare is having to offer. And if that's a better plan, you may want to go on Medicare while you're still working. Use this special enrollment period. Now remember, you always have to take into account how that decision to go on Medicare will affect others that are covered by your insurance plan. Secondly, we know that there are many people who are still working, but they have set a retirement date sometime in the future. And we really highly suggest that about 90 days prior to your retirement date, when you lose your insurance, you need to start doing all the paperwork that's necessary using the special enrollment period. Again, 90 days in advance is plenty of time. So let's suppose that your insurance is going to stop July the 1st, and you're going to retire the very last day of June, and you need to start Medicare in July. Again, we'd like to talk with you about 90 days prior to that, doing all the special enrollment paperwork that's necessary so you can come into Medicare very smoothly, very seamlessly. You'll stop the group plan and go on to Medicare, and that can be done in about 90 days prior to starting Medicare. Now, this last statement says that you can sign up and start Medicare coverage anytime within 8 months after, now notice this, after your current or your active employment provided coverage ends. Now, this scenario it normally works out this way. These are for people that may show up to work one day, and again, they're over 65. They may be 72 or 69, and they find out that their job has been terminated. Maybe their department is closing down or the company is going out of business. And very abruptly, they're going to lose their group plan. There really is no need to panic, because if you're still working and you lose that coverage, you actually have 8 more months to come into Medicare. Now, it will not take 8 months to start your Medicare benefits, but you still have that 8 months of what we call grace period. And so if that's your scenario, what you'll need to do is come into Medicare using your special enrollment period. The main thing we also want to point out here is this extra 8 months of grace belongs to only those people that are coming off current active employment provided coverage, which means someone is still working, right? This doesn't mean that if you're on COBRA right now and turning 65, that you have an extra 8 months. Or if you're on a retiree plan and you're coming into Medicare, that you have an extra 8 months, because you do not. Only those that are coming off active employment will get that extra 8 months. So if you're turning 65 and you are on a COBRA plan or retiree plan, just remember you want to use your initial enrollment period, because the special enrollment period is not something that you are going to be able to utilize. And then we highly, again, recommend that you start this special enrollment period in any of these scenarios 90 days before your desired Medicare start date. All right, so that's those of you that are in scenario number 3. You've worked past 65, ready to retire. And so let's go through just a quick summary here of the details of using an SEP and using that enrollment period. First of all, what we have to do is you're going to need to prove that you have had continuous credible coverage based upon active employment since you turned 65. The way we do that is there's a form called CMS L564, and your employer is going to need to fill that out. If you work with us, we're certainly happy to send that to you in PDF form. Your employer, the HR department, will complete that. It's very simple to do so. Step number 2, then there's another form called CMS Form 40B, and this is your request to enroll into Medicare. That form needs to be filled out by you. We'll show you how to do that as well. And then we highly suggest that you hand deliver both of those documents to Social Security. Typically, an appointment is not necessary. Now, it is true that Social Security would say, oh, you can just mail that in, or you can just drop that off the office. Our experience has been that many times those do not get processed properly. So we like you to take the time to hand deliver to somebody there at the counter at the Social Security office, and those will then typically get processed properly and will get to the right department, so that we don't have to find out 2 or 3 weeks later that they don't have your documents in their system. system. And so that's the safe way to do it. And then step number 4, your card will arrive from Medicare in about 4 weeks of completing this process. So that is using the special enrollment period. Again, we recommend doing this process 90 days before you want your Medicare to start.
Okay, that was great, Dad. Thank you so much. Everyone, take a deep breath. I know that was a lot. I'm going to do a quick review here real quick. So there's 3 types of people. The first type, those who are turning 65 soon and retired already or retiring. What is your responsibility? Well, you are going to enroll into A and B, Original Medicare A and B, using your initial enrollment period. If you're on Social Security, your card should show up about 100 days before your birth month automatically. If you're not receiving a Social Security check, you're going to need to self-enroll. Second group, those who are 65 or maybe 70, but you plan to continue working. You do not have to do anything right now, okay? You can sign up for Part A if you'd like, but you do not need Part B, okay? Now you're welcome, if this is you, to go through and compare the costs and the coverage that you have on your work plan and compare that to Medicare. We find when people do that, about half of them decide to go on Medicare and about half of them decide to stay on their employer plan, but that is up to you to compare. If you decide to stay on your employer provided plan in the future, you will enroll using your special enrollment period, okay? Now, this third group is those who've worked past 65 and now it's time for you to retire. You are going to enroll into A and B using your special enrollment period. Here's what you're going to need. You're going to need proof from your employer that you've had continuous coverage since you turned age 65, okay? If you've had that, then you will not have any Medicare penalties. You'll have no gaps in coverage. Everything will be seamless, okay? You're going to use these 2 forms to go ahead and sign up. Now, if that's basically everyone who's watching this. You should fall into one of those 3 groups. Now, if all this sounds like a ton of confusion and work, that's okay. I'm going to show you, whenever we get to the end of this presentation, how you can get an expert to walk beside you and figure all this out and help you get all this set up in the proper manner. Okay, so let's dive back into the 4-step formula. We just covered step 1, determining the correct enrollment period. Let's go to step number 2. You need to decide between Original Medicare or a Medicare replacement plan.
All right, thank you, Josh. So let's look at these 2 options for your Medicare coverage. Option number 1 is what we call the Original Medicare system. Of course, that began in 1965. And here's what it looks like. This means that you enroll in the Original Medicare A and B. Along with that, you're probably going to get some type of a Medicare supplemental plan to fill in the gaps that the Original Medicare does not cover. And in addition to that, we also have to get a prescription drug plan for your medications that you take. We call those standalone drug plans. So that's what the coverage will look like if you decide that Original Medicare is in your best option. Option number 2 is to do something totally different. This is a system that came into being in 2003. These are called Medicare replacement plans, or we call them Medicare Advantage plans. And those plans, in regards to the drug coverage, will have an embedded prescription drug plan just included within that Advantage plan. So those are 2 options that are before you, and it's the only 2. And you ultimately are going to have to decide which one of these is going to be the very best coverage for you. So what we're going to do first off is focus on option number 1, staying in the Original Medicare system. Original Medicare has 2 main parts. Part A, which is basically everything that's going to be inpatient care. Part B, pretty much everything that's going to be outpatient care. So let's look at Part A and what you need to know about Part A. First of all, it's going to cover everything that relates to inpatient services, which means you've been admitted to a facility. Now, for 99% of all people, there is no cost for you to have Part A. Now, there's cost involved in Part A, but as far as having a premium, there's no monthly premium for Part A for about 99% of all people. If you or a spouse that you're drawing benefits from has paid into the Medicare/Social Security tax system for at least 40 quarters, Part A will be free to you. In addition, Part A has no networks whatsoever. In other words, you can go to any inpatient facility, be that skilled nursing or be that a hospital, and you don't have to worry about whether they're in your network or not, because there's no networks. As long as that hospital or that skilled nursing facility takes Medicare money, you're eligible to go to that facility. And so what will be covered under Part A, first off, you've been admitted to the hospital, so all the inpatient hospital care bills will be paid by Part A. Secondly, skilled nursing facility. This is nothing more than inpatient rehab. Maybe after a stroke or after a joint replacement, the doctor wants to admit you to facility for rehabilitation. That'll be skilled nursing, and Part A will pay the bills. In addition to that, hospice. If someone is on Medicare and they have been diagnosed with a terminal illness, 6 months or less to live, then the hospice bills will be paid by Part A of Medicare. And then lastly, home health care. Again, used very frequently today because it is the lowest cost option for rehabilitation. In this scenario, someone's been in the hospital, and then instead of sending them to a skilled nursing facility, doc sends them home, and then a Medicare-approved home health care agency will come to the home for the rehab, and Part A will pay the bills for that. And so that's the coverage. Now we want to talk about the cost. In other words, your financial responsibilities and your financial liabilities involved in using your Part A of Medicare. First of all, it begins with the deductible of $1,316. Now this is the deductible that's been established for 2017. Now this deductible is not an annual deductible. I know most people are accustomed to annual deductibles. Medicare does this deductible a little bit differently. They call it a benefit period. And a benefit period begins when you're hospitalized, and then eventually you're discharged, and the benefit period continues 60 days after you've been discharged, which means if something happens after you're discharged during that 60-day period where you have to go back to the hospital, it could be the same event that caused you to be rehospitalized or a new event. The event doesn't matter. It just means that during that 60 days of being discharged, you have to be rehospitalized. You're in the same benefit period and you're under the same deductible. But if 60 days has lapsed after you've been discharged and then something would cause you to be rehospitalized, then you will actually start a new benefit period and you're going to have to pay another deductible of $1,316, which conceivably means you could pay this deductible up to 5 times in a year because it's tied to a benefit period and not an annual period of time. And so what will be covered here, of course, will be hospitalization, and up to 60 days in the hospital, that's all you will be billed by the hospital. Folks, it doesn't matter if you're in the hospital 1 day or 2 days or 10 days or 60 days. That deductible is all you'll have to pay. And it doesn't matter if the bill is $50,000 or $1 million. The first 60 days, the only thing out of your pocket is $1,360. That's it. Now, if you happen to be in the hospital longer than 60 days, which is fairly uncommon, but if it happens, here's the way Medicare is going to bill that. After 60 days, the next month, 61 days to up to 90 days, you're going to pay $329 a day copay, which is almost about $10,000 for that month alone. If you're still in the hospital, again, you're very ill at this time, the next 2 months are going to cost you about $20,000 per month. And so this is the way Medicare is going to bill it for extended hospital stays. So that's hospitalization liability. In addition, as we said, Part A also will cover your skilled nursing, inpatient rehab. Your responsibility is this: the first 20 days, no cost to you. Medicare says as long as you have been in the hospital at least 3 days, so 3 days or longer, then they will pay all your expenses for the first 20 days. If you're in less than that, 3 days, Medicare won't actually pay anything. But if you've been in the hospital 3 days or more, there's no cost to you for the first 20 days. After that, Medicare covers you another 80 days at $164.50 per day, which ends up being about $5,000 a month. So that's skilled nursing facility. So that is Part A of Medicare. Now let's talk about Part B and what you need to know. First of all, Part B primarily is going to cover things that are related to outpatient services. Now, Part A was free, but Part B is not. Part B has a monthly premium. The 2017 rate is $134 a month. Now, if you're on Social Security, that $134 is going to come out of your Social Security check. If you're not, they're going to bill you for that on a quarterly basis. And so again, most people pay $134. Now, if you're single and you have a modified adjusted gross income of $85,000 or less, this is what you'll pay for your Medicare Part B if you start in 2017. If you're a married couple and your modified adjusted gross income is $170,000 a year or less, then again, you each will pay $134. The modified adjusted gross income is your adjusted gross income plus tax-free interest income. And so Medicare establishes that threshold. So if you're single below $85,000 or if you are married and below $170,000, you will pay $134. Those of you that will be above that threshold, you will actually pay a surcharge. In other words, you'll pay more money for your Part B premium. And again, that's very important for those of you that are high income, and we can have that private discussion to establish exactly what your Part B will be. But again, most people are going to pay $134 for their Part B premium. Now, with Part B coverage, everything that's related to outpatient services, there are also no networks. You don't have to worry about HMOs and PPOs within the Medicare system. As long as that doctor, that surgeon, that durable medical equipment provider is in Medicare and they take Medicare money, then you will be able to go to that particular provider. So you don't have to worry about networks. Medicare is the network. Next question is, what will Part B cover? Well, it's going to cover everything that's related to outpatient services. So that would include any kind of outpatient surgery, lab work, MRIs, those types of things. It includes also all doctors and specialists that you go to see in their office or they come to see you in the hospital. Remember, Part A pays the hospital. Part B always pays the doctors, whether that's inpatient or outpatient. In addition, Part B will pay for all the preventive services. Many of you ladies probably do your annual wellness exams. That's included in your preventive services, and Part B will pay the bills. Men have services that they're covered as well. And again, Part B will pick up those expenses 100%. And then also durable medical equipment. It could be that someone needs a wheelchair or a walker, or maybe they have a CPAP machine, or maybe they're an insulin-dependent diabetic and they need test strips or lancets, or maybe an insulin pump. All those things, walkers and beds in the home and those types of things are called durable medical equipment. And Part B will pay the bills for those types of things. And then lastly, home health care. And you'll recall that we saw home health care coverage on the A side. So it's also on the B side, because this would be home health care that's necessary after an outpatient surgery. A doc sends you home and the home health care agency will come, and because it started in the outpatient side of Medicare, these home health care bills will be also paid through the Part B. And so that's what's covered. Let's look next at your financial responsibilities, your financial liabilities. Well, Part B begins with a deductible of $183. It is not like the Part A deductible. Remember, that was tied to a benefit period. This is just simply an annual deductible. More accurately, it really is a calendar year deductible. You pay the full deductible that year, regardless of when you start your Medicare benefits. So if you start in July, you'll still have a full deductible of $183, and it's not prorated, and that deductible must be paid by December 31st, and then this will reset again in January 1, and then you'll have a full 12 months. But again, it's not prorated. It's a full $183 for 2017. Now, after that deductible is met, Medicare is going to pay 80% of the bills. You're going to be responsible for 20%. Now, I want you to know that the 80% that Medicare covers is based upon those things that Medicare says are medically necessary. All right, just because you feel like you need to have something done, a procedure, doesn't mean Medicare is going to cover it. So you always have to ask, is this Medicare approved? Is this something that is medically necessary? And if it is, Medicare pays 80% of the bills. Your responsibility is 20%. Now, the problem with your 20%, which is called co-insurance, is that there is no limit. Your 20% is unlimited. Now, all of you who are not on Medicare, your plan stops somewhere. We call it a maximum out-of-pocket. And most plans set an annual max out of pocket. Medicare does not do that. Both A and B of Medicare has no stop loss whatsoever. They're both unlimited. So sky's the limit on your financial responsibility. And then lastly, something else that's unique to Medicare is there are some physicians that do not agree under contract to accept Medicare approved amounts. Now, a doctor that does not accept Medicare-approved amounts can legally still see you on Medicare, can still file claims with Medicare, and still get Medicare reimbursements. But that doctor is going to add up to an additional 15% to the Medicare-approved amount. That is called an excess charge. Medicare allows doctors to do that. Okay, now, doctors that don't charge the extra 15% are called doctors under an assignment contract. And that assignment contract doctor cannot bill you beyond the Medicare-approved amount. But a doctor not under that contract will add 15%. That's called an excess charge, and you are responsible for it.
So let's review these financial liabilities very quickly. Part A, you've got a $1,316 deductible, which you could pay multiple times a year. There's also some daily hospital copays and skilled nursing facility copays. B, which is outpatient side, you've got a $183 deductible once every calendar year. Then you're going to pay 20% of all the bills, no max. The sky is the limit. So if you had $1 million worth of bills, you'd be on the hook for $200,000. Okay, and then on top of that, you can be charged a 15% excess charge. Okay, so you could pay up to 35% of all your bills with no max on that.
Now, folks, Josh just reviewed with you the gaps that are involved in the Medicare system. In other words, the financial responsibilities that Medicare expects you to pay. Those are yours. Now, again, Medicare pays very well, but it is not 100% coverage. And so you have to share in the cost of some of your health care needs. We call that cost sharing or cost shifting. Okay, that's just simply means there's a gap in your coverage. Okay, these are expenses you're responsible for. So either you pay for those expenses out of your own pocket or you purchase what is called a Medicare supplemental plan. Some people call these Medigap policies. They are the same. And so you purchase an insurance policy so that those policies then can cover those expenses for you. All right, so there's 10 supplemental plans that are on the market today: A, B, C, D, F, and G, K, L, M, and N. Okay, now these plans are all standardized by Medicare. And what we mean by that is that Medicare, not the insurance company, will determine each of these plans' benefits. Okay, so the insurance company is not picking and choosing what they're going to pay and not pay. Medicare has already determined that. And then the plan that you purchase then is going to follow those items that Medicare says now you will be responsible for. All right, and so again, those plans, 10 available. And in most markets throughout the country today, about 95 to probably 97% of all people are purchasing Medicare supplemental plans F and G. And so we're going to focus on that today. Doesn't mean the other plans are not good. It's just the majority of people find that they're more comfortable with eliminating most of the risk involved in these gaps, and F and G is going to do that primarily the best. And so the plan F is the one that covers all the A and B gaps that we just taught you. Okay, the deductible on the A side, remember the $1,316, the deductible on the B side, the $183, the co-pays you're responsible for if you have extended hospital or skilled nursing stays, the 20% co-insurance. Part F will pay that 100%. And then if you happen to go to a doctor, that adds that extra 15%. Your Plan F will also pay that. So the point is, if someone has a Plan F, and as long as Medicare paid first, then that F plan will pick up all the balance, 100% of the remaining expenses, 100% of the time. You should really never get a bill. We tell the folks who take Plan Fs that if they do get a bill, don't pay it quickly. Let's find out what happened. Normally, it's a coding issue. It wasn't coded correctly. Medicare didn't pay, and therefore the F didn't pay. Remember, F's going to follow as long as Medicare paid first. Or it could be that you did something that Medicare says, we're just simply not going to cover that. All right, and so if they're not going to cover it, the F plan's not going to either. And so as long as Medicare pays, then F will follow 100%. Now the Plan G is very close. Again, it's going to cover all the A and B gaps that we just discussed, except the Part B deductible. This year, that's $183. So that would be your responsibility. All right, so that's the difference between F and G. F pays everything, G pays everything except for the $183. And so if you have a Plan F, you will not pay any bills. It's 100% coverage from day one as long as Medicare paid first. If you have a Plan G, you will only pay your Part B deductible. Again, this year that's $183, and then nothing more after that deductible has been met.
Okay, Dad, let me just review this. So we have all these financial liabilities. If you buy a Plan F, everything is covered. Ladies and gentlemen, if you purchase this, it's 100% coverage right out of the gate. Okay, the Plan G, almost everything is covered. Everything will be covered except for this $183 deductible that's circled. That is the only difference between a Plan F and a Plan G. So in summary, I need you to realize this. All F plans, no matter what insurance company you purchase it from, will offer identical benefits. A Plan F is a Plan F is a Plan F is a Plan F. One company is not going to cover something that another company would cover. They're all going to cover identical benefits, okay? Just the same, all G plans, no matter what insurance company you purchase it from, offer identical benefits. What's going to be the difference then? Well, the name of the company and the premium you're paying for that plan, Now, original Medicare will not cover a few things.
And that is this. Let me go through that list real quickly, Josh. Original Medicare is not going to cover, first off, long-term custodial care. Folks, as a reminder, Medicare exists for the purpose of covering diseases and illnesses and accidents and injuries, those kinds of things that they determine to be medically necessary. Long-term custodial care is important, but Medicare doesn't cover it. This is for people that are in a situation, maybe because of age or some type of an illness, where they need assistance on a daily basis with bathing, or maybe dressing, or eating, or getting in a wheelchair, or from the bed to the wheelchair, or maybe they can't take the right medications because of dementia or Alzheimer's. Those are custodial needs. Medicare is not going to cover those type of things. Also, Medicare will not cover routine eye or dental care or dentures. Now, let's suppose that you're a diabetic. It is necessary medically for you to have two eye exams every year because of the complications that diabetes can have upon your eyes. Well, those are medically necessary, and that would be covered by Medicare. But if you don't have diabetes and you're just kind of curious if you need a new prescription and you're having really no vision problems, then that routine eye care will not be covered by Medicare. Again, dental care. Let's say you need a root canal, or you need a crown, or an extraction, or a filling, or something. That's not going to be covered by Medicare. They determine that to be not medically necessary, certainly not dentures either. Now, in addition to that, if you decide you need some kind of cosmetic surgery or elective surgery that Medicare says is not medically necessary, Medicare will not cover it, nor will your supplemental plan. Remember, Medicare has to pay first, and then the Medicare supplemental plan is going to follow. Now, Medicare will cover chiropractic adjustments, but if you go to a chiropractor and the chiropractor suggests acupuncture or maybe wants to do x-rays or something at the office, Medicare will not cover those expenses. Just the adjustment of the spine will be covered by Medicare. And then lastly, hearing aids or any hearing exams for fitting those hearing aids will not be covered by Medicare. And our point is this: if Medicare is not going to cover it, then your Plan F is not going to either. And your Plan G is not going to either. Medicare must pay first, and then those other plans are going to follow what Medicare did not pay according to the rules of that particular plan. Now, let me just mention there is one exception to this. Remember, Medicare must pay first. The exception is what we call foreign travel emergency benefits. If you happen to be out of the country, Medicare is not going to pay any expenses, but several of these plans will actually give you $50,000 worth of foreign travel emergency benefits. So if something happens outside the country, the plan will actually help you with some of those expenses. There is a limit to that, and there's some rules to that. Number one, it'll only pay up to $50,000 over your lifetime while you have the plan, and after a small deductible, then the company will pay 80%, and then you pay 20%. And so we just want to remind you that Medicare only covers you while you're in America and then in the U.S. states or in the U.S. territories. And then these plans will pick up an additional $50,000 for you since Medicare will not cover anything. Okay? Now, option number one, what you need to know is this: starting on your Part B effective date, meaning you're off a group plan, you're off an individual plan, and you're going on Medicare. When that Part B effective date begins, you're going to be given a 6-month window. And during this 6-month window, you're going to be given a once-in-a-lifetime right to buy any Medicare supplemental plan. All those 10 are available to you, and there's absolutely no medical underwriting whatsoever, which means even if you have pre-existing conditions, the insurance company is going to give you that policy. Because frankly, we do not have to ask you any health questions during the 6-month period of time. All right, so 6 months to buy anything that you want, regardless of your health status. Now, here's the way it works. That 6-month period of time begins on your Part B effective date. So you can take a plan any time during that 6-month window of the effective date with no underwriting. But you don't have to wait until that period of time, because insurance companies can actually legally take your Medicare supplemental application 3 months prior to your Part B effective date. Now, it's not going to start until the Part B starts, but they'll take it 3 months in advance so you don't have to wait until your Part B starts to make a decision about what supplemental plan is best for you. This can be done 3 months in advance, and you can shop and compare and get everything set up so that when your Part B begins, your supplemental plan will begin on that very same day as well. Now, Medicare supplemental plans are issued as guaranteed renewable for life. There are several plans within the Medicare system that are only good for a year at a time. That's the Advantage plans and the drug plans, which we'll talk about. But the difference is supplemental plans are for the rest of your life. In other words, the insurance companies can never cancel a supplemental plan unless you miss a premium. So if a person misses a premium, the insurance company is required to give you 30 days of grace to pay the premium in order to bring the policy current, and that policy will keep going on for the rest of your life if you want to keep it. But if you miss a premium and you do not bring the policy current within that 30 days, they then have the right to cancel that policy. But as long as you pay the premium, it will be for life. Now, I've covered option number 1 in great detail. Hopefully that makes sense to you. So if you stay in option number 1, that means you're using original Medicare. Medicare is going to process the bills and they're going to pay claims for you. A is going to pay inpatient, B is going to pay outpatient. But because of the gaps, we have added a supplemental plan to that, one of the 10 that we just discussed. Most people, again, go with F or G. And then in addition to that, of course, you're going to have a drug plan that will be included. So those are the details of option 1. Now let's look at option number 2. These are called Medicare Advantage plans or Medicare replacement plans. And again, the drug coverage will be included within the Medicare Advantage plan. So what you need to know. Number 1, Medicare replacement plans are usually called Medicare Advantage plans or Part C of Medicare. And again, to be able to have a Medicare Replacement Advantage plan, you have to be enrolled in Parts A and B of Medicare, which means the A, which is typically free, will continue to be free, but the B, you're going to have to pay that premium. Again, this year, $134 for your Part B. Also, these Medicare replacement plans are offered by private health insurance companies. In other words, the government does not make these available to you. They just simply approve the companies and the coverage that they're going to be offering to Medicare recipients. So that's the difference. Original Medicare A and B is that government system. This is a private health insurance company that's replacing A and B. These plans do have networks. That's one of the biggest differences. Original Medicare had no network. You'll always have a network. In the Advantage plans, it'll be either the HMO plans or the PPO networks. In addition to that, another difference is you will pay a copay for all your services. In the original Medicare A and B, we had very few copays. Remember, only for extended hospital and skilled nursing stays. But when you go on an Advantage plan, you will have a copay for everything that you do until you hit a certain maximum out of your pocket. So it's a copay-based plan. And so here's a sample of those copays. You can see if you go to your primary care doc, somewhere between $5 to $25. You see a specialist, $40 to $50. If you go to urgent care, you'll see it's $30 to $50. The emergency room, again, here's the range for that. If you have an outpatient surgery, let's say cataract surgery or maybe your gallbladder removed or something, you'll pay a copay for that. Your MRIs, your CAT scans, PET scans, each of those tests are going to range somewhere between $250 to $400. Every time you go to outpatient rehab, usually it's about 3 days a week. Each time you did that, you would pay a copay for those services. Your labs and x-rays, again, will be $0 if it's preventive. The Advantage company will cover those costs for you, but if it's something that's diagnostic and non-preventive, then you will pay up to a $50 copay for labs and x-rays. And then the hospital daily copays right now are in the range of $275 to $335. Now you recall that the Advantage plans usually do not have a deductible for medical expenses like we did have on the Part A. So the way they bill you is every day you're in the hospital, you're going to pay a daily copay. Most plans will cover you for about a year's worth of coverage, and you only have to pay the daily copay for up to 5 days and sometimes 6 days. And this daily copay covers every service that you receive while in the hospital that day, whether that's minimal service or major service. That daily copay will always be the same up to a certain limit, again, 5 or 6 days, and then they'll cover you beyond that at no cost to you. And then these copays, of course, will be recorded, and they're going to keep a total throughout the year, and then the plans then set a maximum out-of-pocket. So it doesn't matter if the bill's $100,000 or $1 million, you're going to pay in this range between $3,500 to $6,700, depending upon the plan, whether it's an HMO or a PPO plan. All right, so that's option 2 of the Medicare replacement plan. So we see what we need to know. First of all, I want you also to know that the Medicare replacement Advantage plans almost always will have a prescription drug plan included within that plan. It's just simply embedded. Also, what you need to know is that in order to get a Medicare replacement plan, we're going to have to ask you one medical question, and that is, do you have end-stage renal disease? End-stage renal disease is someone that is probably on dialysis, or maybe they're waiting for a kidney transplant. And if that's your medical condition, end-stage renal disease, then you will not qualify to have a Medicare Advantage plan. You'll need to stay in the original Medicare system. Now, let's suppose that you take an Advantage plan and you get end-stage renal disease. The plan will not kick you off. They will continue to cover you and actually cover you well. But you can't change plans and get with the new company if you have end-stage renal disease that you get after starting your Advantage plan. In addition to that, all the plans in the Advantage system will change annually. In other words, it's an annual agreement between Medicare, the insurance company, and you. Right? And there are times when the Advantage plans actually will make major changes. Some of them can even discontinue the coverage, and they can actually pull out of the market. So they will change annually, which gives you the opportunity to also change annually. Remember, we also said that there are networks, that's HMO and PPO networks, and there are specialists and doctors and hospitals within those networks. And those networks also can be changed on an annual basis. Sometimes doctors or specialists or hospitals can even choose to leave that particular plan if they're not happy with the reimbursement rates. Now, these plans can be switched every year. Medicare has an open enrollment period. That's 7 weeks during October 15th through December 7th. So if you ever need to change a plan, this is the time that we do that. And then your new coverage would begin January the 1st of that following year. So those are some things you need to know about Medicare replacement plans.
Okay, hey guys, I really want you to get the differences between option number 1 and option number 2. So here's the 3 most important differences compared to option number 1. Number 1, Medicare Advantage plans or Medicare replacement plans are copay based plans. You're going to pay as you go. There is a copay for every service you receive. Because of this, the premiums are cheaper. You're going to pay somewhere between $0 to $50 a month, so not very much for this coverage. However, if you want to switch back to option number 1 after using an Advantage plan, you must medically qualify in order to switch. Okay?
You know, Josh, let me just add this too, because this is some real confusion. A lot of people think that once they go into Medicare that they can just switch anytime they want, and folks, that's just not true. It is true that you can switch, but there are usually rules that are applied to this switching. And so if someone says, oh, you can just switch, that is not the truth. You've got to know the rules for switching the plan. Go ahead, son.
Right, so now, there is one little tiny exception to this third point, okay, where it says you must medically qualify to switch. For some of you, in specific circumstances, you're going to have a 12-month trial period to try a Medicare replacement plan or an Advantage plan, right? So you're going to be able to try that and then be able to switch back to the better coverage, which would be option number 1, anytime within that 12 months. But beyond that and beyond those people that have that, you're going to need to medically qualify in order to get back to option number 1, which is a supplemental plan. Okay, I've prepared one other slide so you can really get the differences. Option number 1, you're going to have higher monthly premiums. Option number 2, you're going to have lower monthly premiums. Okay, number 1, premium-based coverage. You're going to pay a monthly premium. Option number 2, this is more pay-as-you-go. Okay. Option number 1, little to no out-of-pocket expense beyond the premiums. Okay, you get a Plan F, it's 100% coverage. You get a Plan G, you have a $183 deductible, and then everything is paid for after that. Option number 2, you're going to pay a copay for every single service you receive, up to the annual max, which will reset every January 1st. Option number 1, you have to purchase a standalone Part D prescription drug plan. We're going to talk about that here next. If you go with option number 2, usually a prescription drug plan is included in the plan, okay? If you go with option number 1, that's your plan for life. They can't cancel it on you, okay? Option number 2, the plans can change yearly. Hey, plans can pull in and out of markets, okay? They'll change the plan every year, guaranteed, okay? Option number 1, medical underwriting is required to get these plans. You get a supplemental plan, you're gonna have to be medically underwritten, except whenever you first go on Medicare during those first 6 months, right? That's your open enrollment. You're guaranteed issued to be able to get whatever plan you want with no medical underwriting. If you go with option number 2, there's pretty much no medical underwriting except you can't have end-stage renal disease. So you can almost always get a Medicare Advantage plan, but you can't always go back to option number 1. So here's the big picture. Option number 1, you have original Medicare plus a supplemental plan. Option number 2, you just have a Medicare Advantage plan. Now, if you go with option 1, you've got to get a standalone prescription drug plan. Option number 2 has a drug plan included. So that brings us back to our 4-step formula. Step number 1, determine your correct enrollment period. We did that. Step number 2, we're going to decide between original Medicare or Medicare replacement. We just went over that. Now, guys, if that was a lot to get, a lot to understand, I want you to know at the end of this presentation, we've worked out a really special deal that I think almost all of you will take advantage of in order to learn how to work with an expert so that we can help you say, hey, which of these options actually is better for your specific situation? So we're going to go into that here in just a few minutes. But before we do that, let's go to step 3. Compare drug plans using a simple process.
All right, Josh, thank you very much. So first of all, folks, in dealing with the drug plan, what you need to know about drug plans. Now, all drug plans, first of all, are going to have a network of pharmacies. Within the network of pharmacies, we have preferred pharmacies and standard pharmacies. Preferred pharmacies are going to give you a better price. So you always have to find out, is the pharmacy that you would like to go to, is it considered preferred or standard? If it's preferred, again, the pricing will be better. Your copays will be cheaper. If you have standard, again, you're going to pay a little bit more for that. Also, all the drug plans are going to have a unique drug formulary. And folks, this is the most important part of deciding upon a drug plan. You want to be sure that you can get all your medications covered by the formulary. And then, frankly, there are some meds that will never be covered by Medicare. But if we know Medicare says it's medically necessary, then we want to find a formulary that is best for you. Every prescription that's covered in that formulary will also have a number beside it called a tier number. And all that tier number does is establishes what your copay price will be. Also, all the drug plans are annual contracts. Okay, in other words, you can change them on an annual basis because through your life you may add medications or you may drop medications. Sometimes medications are very inexpensive, other times they're very expensive. And so Medicare makes an allowance for you to be able to change drug plans if your situation changes with your medications. Again, the open enrollment period, as it was on the Advantage plan, the same time for drug plans, October 15th through December 7th. So they give us a 7-week period every year to make sure that we have the right drug plan, and so you can change plans, and the new coverage would start January 1st of the following year. In addition to that, all drug plans will utilize 4 stages that reset every January 1st. So they reset every single year. Now, let me tell you what we mean by this. Let's compare your present plan, meaning your group plan or your individual plan. You almost always only have 1 stage on non-Medicare plans. That stage is you pay a copay. And that copay is what you pay when you get the prescription filled. Whether you get it filled in January or July or December, you just simply pay a copay. So that's a 1-stage plan, copays only. It's not that easy in Medicare. Medicare has a 4-stage process. So there's 4 stages you have to be aware of, and I want to make sure you understand these very clearly. Stage number 1 is what we call the deductible stage. Medicare establishes the deductible for Part D plans. The insurance companies do not determine this. Medicare says what the deductible is, and that is $400 this year, 2017. Now, one nice feature about it is that deductible is usually not applied if you're just taking generic medications. But it does apply on almost all plans if you're taking brand medications. So the $400 deductible can be waived for generics, but you'll pay it on the brand names. So again, the deductible is generally waived on generics, and then after you've met this deductible or you're on a plan that waives the deductible, then you move to stage 2. And we call stage 2 the copay stage. All right, so I'm going to give you a quick sample of what some of the copays will be depending upon the tier. And you can see tier 1, very low cost, tier 2, again, very low cost. And then we start paying a little bit higher premium for tier 3s, preferred brands, and non-preferreds a little higher for that. And then specialty drugs, which very few people are on, but whenever you are, that's a co-insurance, a percentage of the cost of medication. And again, this is our copay stage. And folks, what happens is this is all you will pay until you reach a total retail cost of $3,700. And again, this is something unique to Medicare because every time you get a prescription filled, Medicare is actually tracking the retail cost of that medication. Now, you don't pay the retail cost, but Medicare tracks it. And The reason they're tracking it is because once you reach this $3,700 of stage 2, then you've reached the maximum on this stage, and then Medicare is going to move you to stage 3. But I want to emphasize this is total retail cost. So they're tracking the retail cost of the medications, and once it reaches $3,700, whenever that is, that could be in September, it could be in July. I've seen people meet this in 1 month, but whenever that is, then you're going to move to stage number 3. Okay, and that stage number 3 is called the coverage gap. We call it the donut hole. And so the only reason people ever go to the donut hole is because they have reached that threshold on the retail amount of $3,700. Okay, and so once they reach that threshold, they go to the donut hole, and now medications typically get more expensive. If you're on a generic medication, no longer are you going to pay a flat copay, you're actually going to pay 51% of the retail cost of that medication. If you're on a brand name medication, you'll pay 40% of the retail cost of that medication. Okay, so again, your out-of-pocket expense is going to change here in stage 3. Oftentimes, we'll see your out-of-pocket expense in stage 3 double or even quadruple. You're taking on a greater financial responsibility. That's why most people hate the donut hole, right? And so you're going to remain now in this stage until total out-of-pocket cost reaches $4,950. That's your out-of-pocket cost, which includes the deductible that you had to pay. It includes all the co-pays that you've had to pay. It includes everything you spend in this stage as well. The 51% of the generics, 40% of the brands. All that's going in your total out-of-pocket cost. So they're totaling that cost, and once it reaches $4,950, then you move to stage 4. Now here's the good news. That total is not all out of your pocket because Medicare makes the brand name manufacturers discount your medication 50%. And that 50% discount is included in that $4,950 number. So in there was your deductible, your co-pays, your co-insurance, and the 50% that you didn't pay that the manufacturer had to discount. So again, that's not out of your pocket, fortunately. Okay, then if we meet that number, $4,950, then we go to what's called a catastrophic coverage. Now, this is a place where no one's upset like they were in the donut hole because medications are very inexpensive. You'll pay the greater of 5% of the retail cost or a flat copay for generics and a flat copay for brand name medications. Okay, so again, these are the 4 stages. When you start your Medicare, you start working through these 4 stages based upon those financial numbers. And then again, these are going to reset every January 1st. And we start with stage 1, we just go all the way through stage 4 again. So stage 1, again, is a reminder, the deductible stage. Either you pay it out of your pocket, $400, or it will be waived by the plan. Stage number 2 will be copays. Again, everyone's happy here. We're just simply paying small copays depending upon the prescription that you're on and depending upon the tier that has been established for that particular medication. And we stay here until the total retail cost reaches, in 2017, that number is $3,700. Again, that's not your cost, that's the retail cost. And once we reach that amount, then we go to stage 3. And here we're in the donut hole. Again, paying 51% of the cost for generics and 40% of the brands. And we stay here until total out-of-pocket costs reach that $4,950 number, which was everything you paid in stage 1, stage 2, stage 3, and the manufacturer discount of 50% on the brand name medications. And then we go to stage 4. Again, everyone's happy here. Medications are very reasonable. You pay 5% of the actual cost of those medications. So this is step 3. In other words, we've shown you what is going to be covered and what your financial responsibilities are, but let me show you how to compare drug plans using a very simple process at Medicare.gov. So first of all, we want you to make a list of your medications in the following format. We want to know what the actual medication name is. Whether it's a brand name or a generic, whatever you're taking is the name you're going to use. Then what's the dosage? Are you taking 10 milligrams or 20 milligrams? You want to make sure you record that. And then how often? Is it 1 a day or 2 a day? So we want to know the frequency. So this is your list of medications. Then secondly, what we're going to do is we need to know what is your preferred pharmacy. What's your pharmacy of choice? And we also recommend recommend that you select a second pharmacy that you would be open to going, because sometimes the prices of your medications can vary, so it's best to use two. And the Medicare.gov system will actually shop two of those pharmacies for you, so take advantage of that. And then number 3, you're going to go to Medicare.gov and you're going to input all the information that we just talked about, the medication, the dosage, the frequency, and the two pharmacies that you're open to going to. And Medicare.gov, and within truly seconds of you giving them this information, they're going to tell you what all the drug plans that are available for you in your zip code. Most of them have somewhere between 20 to 25 plans, and it's going to rate those in order of the plan that will give you the best coverage of the meds you're on, and then secondly, at the very best price. And we'll rate those 1 through up to 25. And then number 5 here, Medicare.gov will then automatically give you an ID number. That ID number is very important, and along with that will be a password. And that password is going to be the date that all this information then was saved in the Medicare system. And then each year you can go back through and you can check without having to put all that information back in the system. It will be saved for you. It will be recorded for you under this ID and password. So on an annual basis, you can go back in and amend the information if you need to. You've changed medications, add them, remove them, change dosage and frequency so that your records are up to date, and you can always select the right drug plan for you on that annual enrollment period.
Okay, so hey, we are almost done with the 4-step formula. Again, if this sounds like a lot of work, stay with me for just a few more minutes. I'm going to show you how you can get access to a team of experts who can help you. Step number 1, determine the correct enrollment period. Step number 2, decide between original Medicare or a Medicare replacement plan. Step number 3, you need to compare drug plans using a simple process in Medicare.gov. And step 4, choose someone to process all the enrollment paperwork. So let's dive right into step number 4. Really, you have 3 options when it comes to doing all the enrollments, okay? Number 1 is what I call the do-it-yourself method, okay? Number 2, you can use a captive agent. And number 3, you can use an independent broker. Okay, so let's talk about the do-it-yourself method first. Remember back at the beginning of when we first started about an hour ago, we talked about the normal Medicare path. The people that do the do-it-yourself method, you have a higher likelihood of following this path, okay? How did it go again? You're going to research Medicare alone. You're going to get confused and frustrated. You'll enroll in coverage, not knowing for sure if it's best, and then find out later, maybe days, maybe weeks, maybe months, maybe years, that you made a mistake, and by then it's usually too late to fix it. Here's a few do's and don'ts that if you decide to go the do-it-yourself method, you need to be aware of. Number 1, don't take your neighbor's or friend's advice and assume it works for you, okay? What worked for your neighbor absolutely may not work for you. You have a different set of doctors. You have a different set of health background. You have more medications or different medications or less medications than what they take. Your family history is different, right? There's so many different variables that you just don't assume that what somebody tells you is gospel truth and that you should take it, okay? Number 2, do call all your doctors to make sure they, number 1, take Medicare, and number 2, are in network for the Advantage plan you're considering. Okay, this is a big deal. The last thing I'd want you to do is get on a plan and then find out later that your doctor isn't on the plan. Don't purchase the most expensive plan just because you think the most expensive is best. That is not true at all. Remember, supplemental plans are standardized. A G plan is a G plan is a G plan. It doesn't matter what company you purchase it from. And we see a lot of people messing up whenever they go to choose a drug plan because they don't know how to compare the drug plans. So they end up just buying the most expensive one, hoping that it's the best. And in reality, maybe they're wasting $50, $60, $70 a month on that plan when they would be equally or better served by a cheaper plan. Do read the Medicare and You book. Okay, this is a 150-page book available at the Social Security office. You can get this for free. It's 150 pages. If you're doing it yourself, you need to read this book so that you know and you don't make any mistakes. Around here at the offices, we read this book all the time because really it's one of the best resources available. And then finally, don't think you're saving money by doing it yourself. Okay, don't think that you're somehow cheating the system or that you're going to save yourself a bunch of money. You don't save a penny. All of these plans are built and price to have somebody helping you.
Yeah, in fact, let me just add this, Josh. I think that people oftentimes will try to do this themselves, and they're going to go through a call center thinking this is going to save them money. Folks, that's not true. The price is always the same, whether you use an agent or not, whether you do it yourself or not. You will pay the same price. In fact, I think people actually cost themselves a lot of time, a lot of frustration by not utilizing an expert agent in this regard.
Right. So that's the do-it-yourself method. Method number 2, you can use a captive agent. And you say, well, what in the world is a captive agent? Well, let me explain to you. So there's 2 different types of agents out there that can help you. Number 1 is a captive agent. That means they work for a company, only one company, okay? Now, I can't mention company names on this, but you get the idea. An independent broker is going to work for a host of companies, okay? They're going to represent all the companies that are available. So if you have a captive agent, you really are limiting yourself to the one option that he offers.
Yeah, they're only going to present the portfolio of products that company offers. And sometimes that may be wonderful, but the problem is it may not be wonderful. And so that's why we think that it's best to have more options. In fact, if you decide to use an independent broker, you will have unlimited options. Most independent brokers are going to represent multiple carriers, multiple plans, and so that way you can find really the best fit for you.
Right, so here's some do's and some don'ts. Number 1, do understand the captive agent works for his or her employer, not for you. They're going to be able to offer you just what the company they works for offers, and they are going to figure out a way to try to make that sound like it's the best thing for you. In reality, it may not be. Okay, do be prepared to spend a large amount of time if you're only talking to captive agents. Why? Because if you're doing your homework, you're going to need to talk to maybe 5 or 6 different agents, and this just takes a lot of time.
And something else that's very critical, folks, you need to make sure that the agent checks all of your doctors, all your hospitals, to ensure that they take Medicare. And if you decide you're going with an Advantage plan, you have to make sure that that agent is checking to make sure all your providers are in the network. And frankly, we find that there's a lot of agents who really refuse to get involved in making sure that you're on the right drug plan. In fact, I'll say it this way. If someone does not take the time and is unwilling to take the time to check out every single one of your medications to make sure that everything's covered, it's the very best price, then that agent is not really looking out for your best interest. Just make sure that agent takes the time to be sure that you are on the right prescription drug plan.
I'm going to let you in a little secret here, folks. You need to know that a lot of agents out there are going to push the plans that pay them the most commission, okay? So from highest to lowest, here's what pays the agent the most. Number 1, the Advantage plan is going to pay them the most. Secondly, an F plan, and then finally, the plan G, okay? Well, I'm going to leave that up there. And then finally, the plan G. Option number 3, you can use an independent broker. Okay, and that's what our company is. We're brokers. We'd love for you to work with us, but hey, we know we're not the only ones out there. So here are some things that you need to be aware of. Understand the independent broker does work for you, okay? Not in the insurance company. So don't let them push a plan on you. Say, hey, if you represent other companies, why are you not talking to me about these? Don't assume that the broker knows all the plans ins and outs. I can't tell you how many brokers get into this insurance business. They get in, they get a license, get contracted with all the companies, okay, and they don't try to understand fully the plans that they're representing. So work with somebody who really knows their stuff. Again, like we said before, don't work with a broker who won't assist you in selecting the right prescription drug plan. Prescription drugs are the biggest pain in our business, but we realize the value and we take the time to sit down and figure out what the right prescription drug plan is going to be for you.
Let me say this. This is really a big deal, folks, because statistics say that you will spend more money out of your pocket on prescription drug plans than you will anything else. And so if an agent will not take the time to make sure that they're getting your drugs covered at the very best price, they're not looking out for you in that situation.
If you go with a broker, do enjoy the ease of working with just one person that you can trust, right? And then finally, like I said before, understand that brokers also are going to push the plans that pay them the most commissions. Number 1, Advantage plans pay them the most. Number 2, F plans. Number 3, G plans, okay? And finally, I think it's important that you do not settle for a one-man band that can't support you and service you for years to come.
What is very common in insurance business today is that a lot of people will take insurance as a second career. In other words, they've already had one career and now they're kind of semi-retired and they decide they're going to get in the insurance business. And there's nothing wrong with someone doing that. The problem is most of the people who do that really do not have the history of having helped very many people. And so you want to make sure that you go with someone that has a good history, they know what they're talking about, they have the support staff to make sure that if you have any problems, because it could be that you go with a person and they may not be in business 6 months from now or a year from now. They won't be there for you whenever you need to make a change during the annual enrollment period. So again, go with someone that has a reputation that being in the business for a while and really truly takes care of their clients.
So over the past hour, I hope all of you would agree that it's been time well spent. I know I've enjoyed it. I enjoy every time hearing my dad talk about Medicare because he truly is what I believe the best expert. Secondly, we can't cover your specific situation in a 1-hour webinar. It's just impossible. So I talked to my dad and I asked him, hey, how can we build something that will really help these people with their personal situation and help them navigate the enrollment periods, the government forms, Social Security, and the Part B IRMAs, and stuff like getting quotes from insurance companies and applying for coverage, picking out the perfect prescription drug plan, and getting everything set up perfectly and at the perfect time. Basically, I asked him, how can we help people walk from A to Z and show all of you guys exactly how to do this for yourself? So what we did is we created a very special offer so that you can get answers to a specific situation. And if you act fast, towards the end, I'm going to give you a very special deal. So here's what we created. We created something that we like to call the Ultimate Medicare Success Package. Okay, this is something that is going to help you immensely get the coverage that you need. Okay, so inside of this Ultimate Medicare Success Package, here's what you're going to get. We're going to send you a full-length, in-depth live workshop. Okay, we do this workshop all over the country, and we go into more and more detail than what we went in today. It's a completely different format, but I think it would be super helpful for every single one here to watch that. Secondly, we're going to create personalized for you what we call a My Medicare Blueprint, okay? This is an amazing value to you, okay? What we're gonna do is we're gonna find out your doctors, your medications, the hospitals you need access to, the pharmacy that you like to use. We're gonna find out your history, your work history, your insurance history, your family medical history, and we're going to put together a package that really is going to work well for you. Why? Because you have probably 25 different supplemental companies wanting to sell you insurance. You have 25 different drug plans and probably a dozen Medicare Advantage plans. Okay, so you've got 75 different plan options, and that's going to take you hours and hours and hours to sift through and figure out exactly what works best for you. So what our team of research experts and Medicare experts are going to do, people who do this every single day, all day long, they're going to put together a personalized My Medicare Blueprint built specifically around you. And then we're going to give you a free 60 to 90 minute consultation where a Medicare expert will go over all this with you. Now, we have offices in Overland Park, offices in Kansas City, okay? We would love for you to come, sit down in our office and go over this with you with one of our experts. Or we can do this over the phone. It's really up to you. But inside this package, we've put this all together just for you. Now, I don't want you to get sticker shock from this because I'm going to show you a way you can reduce this drastically here in just a moment. But before we do that, I want to tell you who this Ultimate Medicare Success Package has worked for. Hey, it's worked for the totally confused person. The person who says, I really enjoyed the webinar, but I don't understand what's going on. Would you just do this for me? Okay. It's also worked for the 95% sure person, the person who says, hey, this is usually the engineer types. Hey, I've studied Medicare for a long time. I feel like I know just about what I want, but I really want to just get a second opinion to make sure I'm doing the right thing. Okay. This has worked for the busy person. Frankly, this is me. I've got too much going on to be able to deal with health insurance. So, hey, I hire somebody who would be an expert. Okay. Somebody who I can pass this off to, somebody that I trust, and somebody who's going to take care of this for me, okay? Who has this worked for? This hasn't worked for the complete do-it-yourselfer. Hey, if you're the person who thrives on searching and digging and figuring everything out for yourself, this may not work for you, and we're fine with that. I hope this webinar has been just tremendous value for you. Also, has it worked for the know-it-all? Hey, nobody likes working with the know-it-all, so if we're going to put the time and the attention in this package together, we don't like to work with people who come in and say, hey, all that's terrible. I think this is a better way, okay? Number 3, the person who's 100% Medicaid, okay? If you're on 100% Medicaid, which is the state-run assistance program, Okay, if you're very low income, this probably isn't going to work for you because Medicaid's going to cover all this for you, and nothing that we put together will really even be an option for you, okay, because you don't need it. Finally, if you're retired military and have TRICARE or CHAMPS VA, the government has said, as a thanks for serving our country, this TRICARE or CHAMPS VA coverage is phenomenal coverage, and that's what you're given, okay? So you're probably not going to need to go out and get a bunch of other supplementary coverage. So this probably won't work for you. The only thing you'll probably need to get is A and B only, and then the TRICARE or CHAMPS VA will fill in all those gaps for you.
Now, folks, when we created the Ultimate Medicare Success Package, we really had two choices. Our first option was just to simply go cheap and sell as many packages as possible. The problem was that it wouldn't give us the opportunity to really offer people a lot of value, and so we really didn't like that one. The second option, which required a little higher investment from you, but in exchange, what we're able to do is we're able to devote more resources to your success. And that's really our goal. We want you to be on the right plan for the rest of your life.
Yeah, and so if we go with maybe a little bit of a pricier option to help you, hey, we're going to be able to really help you, as opposed to just selling you something for $50 and saying, hey, hope this works, and go on down the road. Great. Okay, hey, a couple months ago, this guy sent this to me. He said, hey, I'm pretty good at researching things, and it took me a long time, but I finally felt like I knew what I should do about Medicare. After I watched your first webinar, I hesitantly signed up to work personally with Enlighten You. On the day of my consultation, the phone rang, and I almost didn't answer. I'm so glad I did. The gentleman who helped me brought up 3 or 4 points I had never considered and frankly knew nothing about. In the end, I have even better coverage than I originally was going to get on my own, and the process was so incredibly easy and hassle-free. Plus, I saved about $1,600 a year. So hey, if you go with this Ultimate Medicare Success Package, here's what you're going to get. We're going to give you a free, here's what you're going to get. We're going to give you a free 60 to 90 minute consultation with one of our Medicare experts, where they are going to go over a personalized My Medicare blueprint that was put together by our team of researchers. Okay? We're going to send you a full-length, in-depth live workshop. I'm also going to throw in a few other things, okay? We're going to send you how to navigate Medicare.gov like a pro, because every year you're going to need to go over your drug plan, and I'm going to teach you how to do that, okay? Total value here, $902, but I like to reward those who decide and make decisions quickly, okay? So bonus number 1, I am going to give you, if you're the first 30 people who sign up for this, I'm going to give you a private, members-only email address that's going to give you instant access to the experts on our team. Now, we'll have people who will pay us $39 a month just to be able to send us an email and get a reply back within 24 to 48 hours, okay? $39 a month. I'm going to give you a year's worth of that. Secondly, every year things change in Medicare, okay? So here's what I'm going to give you. I host members-only webinars that I charge for, okay? I'm going to give you lifetime free access to that, where you're going to be able to every year get on and watch a webinar that is going to explain to you, hey, here's what changes for next year are in store for Medicare, and here's what you need to do about it. Here's how you need to check and make sure you're on the right plan, etc., etc. This bonus for the first 20 people only. So you see what you're going to get. Consultation, the blueprint, the workshop, videotape workshop, how to navigate Medicare.gov like a pro, the members only email address, $39 a month. I'm going to give you a year's access to that. I'm also going to give you lifetime access to the open enrollment private webinars.
All right, Josh. Well, folks, I want you to think about this for just a minute. If all this package did was eliminate Medicare stress for you, would it be worth that investment? If all this did was keep you from making a lifelong mistake, and I'm telling you, people make lifelong mistakes all the time, would it be worth it to you? Or if all this did was get you access to the best health care available for you, would it be worth it? If all this did was keep you from paying lifetime Medicare penalties, would it be worth it? How about if it kept you from enrolling in a terrible plan that you got stuck in forever? Would it be worth it? If it would save you hundreds, if not thousands of dollars a year on your medical bills and your prescription drug cost, would it be worth it? You see, really, this is a question. What is your health and your peace of mind truly worth to you? Is it worth $1,000, maybe $5,000, $10,000, or $25,000, or even more? How much would you pay to get a Medicare expert's guidance so you'll always have the best care and the best coverage available to you?
So really, guys, I don't know about you, but I think you can see why the Ultimate Medicare Success Package is a great deal at $1,469. However, because you're watching this today, I'm going to let you in on an insider secret and make you an absolutely amazing offer. See, there's two ways we can do business, okay? You can pay us the $1,469 with cash or credit card today, or we can become your agent of record, and the insurance company pays us instead, and you pay us nothing ever. We essentially become 100% free to you.
Josh, let me explain to folks what an agent of record is. First of all, if we become your agent of record, we also become your personal advisor. In other words, you have access to us. You have access to our team, and we will advise you on an annual basis as to what you need to be doing and when you need to be doing it. Secondly, it means we're your personal agent. Again, if we need to get involved in any kind of claim problem or if you have any kind of issue going on, we're your personal agent. In other words, our name is attached actually to your insurance application and your insurance policy. And so we can help you. That's what a personal agent gets to do. And we actually become your personal advocate. In fact, I was working on a case yesterday. There was a billing problem. There was a claim problem. And I picked up the phone. We did a three-way call with the provider, and we got that issue resolved. Folks, we know the terminology. We know the people that we need to talk to get problems taken care of. And so if you don't have a personal agent, what happens is you just simply have an 800 number. And that 800 number is in a call center, and those people work for the company. They're not really concerned that much about you. But when you have a personal agent of record, we become your advocate. We'll help you whenever you have difficulties.
So here's the little secret that I think you guys will be amazed by, and you will find nobody else in the industry willing to tell you this. Here's what insurance agents make, okay? They sell you an Advantage plan, they're gonna make about $440 right up front, and about $220 a year for the next 7+ years, okay? So you're worth about $2,000 to them, okay? Sell a Plan F, they make about $450 up front, plus $200 a year for 5 years. So that's about $1,500, okay? Plan G is the lowest of all, about $350 up front plus $200 a year for 5 years, okay? So now it's way easier for us if you go ahead and pay me that $1,469 for the Ultimate Medicare Success Package right up front.
Now, let me just add this, Josh. And folks, if you decide this is best, we are happy to serve you and take care of your needs with this. And if we do that, we'll tell you exactly what plans to enroll in and exactly what to do. But you would actually have to do the enrollment, because if we take this fee up front, we're actually just your advisors, and you'll have to do the enrollments. We can't be paid with both systems. Either it's a fee for consultation, or you let the insurance company pay us through a commission basis. And again, it's easier for me if you just simply pay us the $1,469 up front. But we do want your business, and we're willing to sacrifice for your business and allow the insurance company to pay us instead over that 6-year period of time. And you can do that by getting started right now. And I can become your agent of record, and the cost is $0 today and $0 forever. And if you decide this is for you and you sign up, here's what's going to happen.
First, you're going to register by clicking the button, Become My Agent of Record, okay? Once you do that, you're going to be taken to a simple sign-up page to enter your contact information, because we need to know how to reach out to you to set up a time to meet with you, to set up time to get your personalized My Medicare Blueprint created. Okay, so an Enlighten You representative, after you've done this, will reach out, get the following information from you. We're going to need to know your prescription medications. We're going to need to know the name. We're going to need to know if it's a brand or a generic. We need to know the dosage that you take and the frequency that you take it. We need to know your primary care doctor, any specialist, because we're going to call them. We're going to check the networks to see if they're in network with the plan. We need to know your hospital preferences, okay? We need to know what pharmacies you use, because we're going to shop them. We're going to need to know any other pertinent health, current information, or retirement information so that we can get a complete picture of you and build the perfect plan for you, okay? After we have all this, our research team will build your My Medicare Blueprint. This usually takes between 5 and 7 business days. After that, an Enlighten You Medicare broker will meet with you in person or over the phone. Hey, you can come to our offices. Right now, I'm sitting in our office headquarters at 7500 College Boulevard in Overland Park, Kansas. We would love to have you come here. Or, hey, we can meet over the phone. We can review all your Medicare options. And then when necessary, if you like what you see, if you like that, hey, they've taken the 75 different plan options down and they've just narrowed it down to the top 5 or 6 options for me. If you like one of them, then hey, we can handle all the government and insurance enrollment forms and applications, and we will complete them at the right time so that you have no penalties and no gaps in coverage. Okay, so now you really have three choices right now. Number one, maybe you're not sure if you need Medicare yet. Let's talk and find out, okay? You can click on the button choice number one, and we can just set up a 15-minute phone call, and we can talk and say, hey, is Medicare really the right thing for you at this time? If so, then we can move forward with working together. Choice number two, you can pony up this small investment today, $1,469. Hey, compared to all the value you're gonna get by working with Marvin and his team of experts, this is a bargain, okay? You guys don't understand. You're gonna be on Medicare for 20, 25, 30 years, and you really need to understand that a little investment up front can really change the course of how your healthcare coverage goes in retirement. Remember, folks, healthcare is the number one cause of bankruptcy in retirement. Number one cause. And I know none of you want to go bankrupt in retirement. So go ahead and get it set up right the first time so you don't have to do it again next year or 5 years down the road. Choice number three is you can let Marvin and his team of experts become your agent of record. And you can allow the insurance company to pay them instead. And you get everything for free. Now, in my opinion, it's way easier if you go with choice number two. But choice number three, I feel, is what most of you are going to go with. So choice number one, if you do that, if you're not sure you're ready for Medicare yet, hit the button, I'm not sure I'm ready yet, and we will be able to just talk for 15 or 20 minutes and determine if you should go on Medicare now or go on Medicare at a later date. We're going to reach out. Once you've hit that, we're going to set up a 15-minute free phone consultation to help you determine if you should take Medicare now or later. Choice number two, you can pay the $1,469 right up front. Here's what we're going to do. We're going to give you a 90-day guarantee. So if you sign up, you pay for this, and if you don't like the package for any reason, I don't care if it's 89 days, 23 hours, and 59 minutes from now, just let me know, and I will give you 100% of your money back.
And just remember, if you do this option, we are not your agent of record. We'll give you clear direction and show you exactly what to do. But we cannot be both agent of record as well as take this particular fee.
Correct. Finally, choice number three, we can become your agent of record. If we do this, if you go with the Ultimate Medicare Success Package, here's what we're going to give you. The live workshop, the blueprint, the consultation, how to navigate Medicare.gov like a pro, members only email address, the open enrollment private webinar, okay? Total value $1,469, and what do you pay? Absolutely nothing, okay? So go ahead and click on that. Now, if you didn't sign up immediately, there's probably 4 reasons. Number one, you're not ready for Medicare. Hey, and if that's you, that's okay. We're gonna be here for years to come. Reach out to us when you are ready for Medicare. We'd love to help you. Number two, you think I'm gonna sell you something later. The fact of the matter is, we make our money, we're paid by the insurance companies. We hope to help you with a plan. We're not gonna ask you for any money down the road at all, okay? Number three, you're already working with somebody. Hey, if you're working with someone, we are not relationship breakers. But what you need to do is you need to make sure that they are really the experts that they claim to be. Okay?
Yeah, and that they're going to offer really all these services that we offer. If you can find someone that's going to do that you like and you trust, then we're really excited about that.
Right, yeah, we encourage you to go with them. Reason number four, you can do it all by yourself. And the truth of the matter is, you can do it all by yourself, but is it really worth making a mistake? Is it really worth spending, most people are going to spend probably between 20 and 30 hours trying to figure it all out, and then they're usually not even sure if they made the right choice.
Yeah, we can get it all done in about 1/10 of that time, and so we'd be happy to help you to do that. And then lastly, let me just say this, and we'll be done with the webinar. With number three, we would really find it a privilege to become your agent of record. We find that most people that work with us are satisfied. In fact, we have testimonials every day given to us, how they were grateful that they had someone who cared enough to, first of all, educate them and then walk them through this process. Folks, ultimately in the end, really the goal is the same. You want good coverage, you want that coverage to be affordable, you want to fit your budget, and you want to make sure that you are taken care of for years to come. And that's exactly what this package offers you. And so it would be our privilege to serve you. Obviously, we are happy to assist and to do everything that we can to really earn your business and to make sure that you're taken care of for years to come. And so we hope that you'll get started by clicking option number 3 here and ask us to become your agent of record. We look forward to that privilege to serve you further.
And folks, I just want to say thank you. This was a long webinar, but you really were patient, and just so thankful that you were able to join us. And hey, I hope that we see your name pop up and that we're able to help you. Thanks so much for being here today.
Yeah, take care. Thank you.